very good morning and a wonderful evening to all of you present here today on a Monday evening. Thank you for taking out the time for this important theme of discussion with us today on the Empower T1D platform. I warmly welcome you all for this very engaging discussion with some experts. And before we begin, I'd like to introduce Empower T1D. So Empower T1D was founded first with the idea that we should have a dedicated type 1 focused space where clinicians can work alongside with community support groups. We started out very small with engaging some support groups in India, and then we got all the support groups together on the same platform. Now we have global advocates as well as more support groups joining us. We have one sole purpose: to have engaging discussions, learning, education, and problem solving, as well as community driven solutions, so that people living with type 1 can improve their care. And we have access to scientific education, authenticated education. On this platform, every month, we meet together to have very engaging conversations. And today, I'm very happy to introduce our amazing moderator, Asra Ahmed. The theme for today's discussion is language matters. Now, one of the most important things is what happens when a person gets diagnosed and walks into a clinic. So, what speaks first? Is it the insulin which is given, or are the numbers checked? Yes, all of that happens, but the language speaks first. The language in which a healthcare professional communicates with the family, with the person living with diabetes, and what it says can really shape the entire experience of that person living with type 1 diabetes. The language we use in diabetes care, it does much more than just communicate. It shapes how people feel, how they respond, and then it defines the future for how they will manage their condition day to day. Asra Ahmed is a diabetes educator, a very well-known global advocate living with type 1 diabetes for over 39 years. She's the head of education as well as the head of decoded diabetes with Diabetes Foundation, working alongside with Jazz Sethi, and her academic background in business and learning disabilities brings here with us today some really deep-rooted as well as diverse learning experiences. I had the pleasure of meeting Asra this time at ATTD Barcelona, and I'm really amazed by her drive to really go all out, not just on education, but to make a huge difference to the lives of people living with type 1. It's a pleasure to share this space, Asra, and thank you for agreeing to be with us today, despite your busy meetings and time differences.
You are most welcome, Riddhi.
Yeah, and we really look forward to an amazing session with you.
So go on.
Yeah, next up we have Bhumika Khurana. Bhumika has been living with type 1 for over 16 years. She's a diabetes educator and advocate and a team member at Yogdhyan Foundation in Delhi. Working around diabetes awareness, education, and advocacy, also helping some of the underprivileged T1D, an active contributor to Hriday, she's really participated in various panel discussions and a few in Empower T1D as well. So thank you, Bhumika, for your continued support to being with us at Empower. She's a strong advocate for holistic diabetes management, mental well-being, and she is, besides her diabetes, an amazing young adult who's done her economics graduate, bringing over more than 7 years of professional experience in the investment and finance services. At innumerable occasions, I have spent time with Bhumika, and her drive to really make a difference is commendable. Thank you, Bhumika, for sparing the time to be with us today. Next up, we have Suman joining us from US, a parent advocate, a fierce protector of how language matters, is working around the world. He has a child living with type 1 diabetes, and his deeply personal commitment is to improve the outcomes for children and families, not just in America, but all over the world. Although he's based in US, he has a lot of interest in what is going on in India at all times. A breakthrough T1D advocate, a columnist for Empower T1D newsletter, and an active supporter of Language Matters movement. Suman is the co-founder of Voice of T1D, and he's deeply passionate about innovation efforts in the non-invasive glucose monitoring technologies. Thank you, Suman, for joining despite being an early morning. And we look forward to have your views, especially as a caregiver, because that's a very different experience. So thank you for being with us. We also have Shweta Sharma, the co-founder and CEO of Sigma Mosaic Solutions. I had the pleasure of meeting Shweta at the End Diabetes Stigma Summit. Shweta brings more than 20 years of experience across pharma marketing, medical communications, and she has deep experience working with clinicians and healthcare systems. Shweta, being the founder of Sigma Mosaic Solutions, has been working dedicatedly on building practical AI-driven solutions for everyday use. The other day when I was talking to Shweta, I was really amazed by her decision of just giving up on a full-time job to take up something that matters so much to people living with chronic conditions. She has recognized the role of language and how it can shape stigma as well as lived experiences, and how advocacy can be improved as well as health behaviors can be really worked upon. So Shweta will give us some solutions as well as what Sigma Mosaic is actually doing that will define and shape the future of how we can drive the Language Matters movement ahead. With that, I hand over to Asra, and I wish all of you an engaging session.
Thank you so much, Riddhi. And it's pretty humbling to be sitting with people with so much experience and so many insights and capacity of understanding why language is important. Language is nothing but words. It's what we say, and it is so powerful in how we feel and how our emotions react and the message we get from the world about ourselves, especially with those of us living with a chronic condition, and in this case, very specifically, type 1 diabetes. It is what highlights that, oh, my doctor said I have so many things to be afraid of. I have so many things to probably carry the blame and the burden and the responsibility. So these are all things that keep adding a layer on top of a layer for us. And I'm very, very interested in seeing Sumanji, whose daughter was diagnosed with diabetes as a very young person, Bhumika, who's living with it ongoing for a few years within India, within the stigma that we do see within our own community, and Shweta ji, who's come up with these amazing solutions and actually taking on the responsibility of going and talking to businesses, going to talking within families, because language is not just that comes in the doctor's office. Language is hitting us every side. When we go out to a coffee morning with our lady friends or our boys in, playing a game of cricket, language is still going to be there, whether you're at work or in a social situation. So, powerful drug or a very, very, very impactful weapon as well. So let's go on to the next slide, please. The Language Matters movement was started a few years ago, and it is truly a global movement. UK, Latin America, in India, in all of Asia, whether it is Bangladesh, Sri Lanka, or Pakistan, or whether it is Australia, and translated into various languages. So a document, a consensus paper was actually set up where language was highlighted as a very, very strong uh, format where impact is felt and delivered. Next slide, please. NHS UK, Renza Shibilia, who's part of DDoC Voices, and Jazz all got together and created a website called languagematters.com. Very simple, very straightforward, and the numbers are staggering. 80% of people feel they are judged and blamed, shamed. And where does this judge and the blame come from? Obviously, from within our backgrounds, within what we thought was normal. Hi, bichari bachchi, suffer karti hai type 1 se. You know, those little words that are not meant ill. They're meant to be very loving and sympathetic, but sometimes they don't come across that way. 50% of people living with type 2 diabetes feel that they are being judged for the way they look. 66% of the people feel judged for the way they might choose to eat a sugary dessert. Yesterday, I chose to have a pizza, and not only did I have a pizza, I had the whole thing all to myself. I did not share a single slice. And when I said this to somebody in another meeting, they were like, huh? You did what? And the empowering of talking about this is where I could answer and say, I knew how to take care of it. So that is the language we would like to give it to all our society, all our community within type 1 diabetes or any other chronic condition, as well as the doctor who heard that, oh, she just made this choice. But it is a matter of choice. I chose to eat it. I planned to eat it and executed it. Consequences are my responsibility. Definitely, I don't need somebody else to tell me or judge me about them. 50% of the type 1 population across the world feel that it's their fault that they have diabetes. So at this point, I would like to invite Sumanji, if you can come in and give your perspective as well as somebody who's newly diagnosed, who has a child who was recently diagnosed. And we can move on to the next slide while Sumanji is speaking.
First of all, thank you so much for giving me this opportunity. I'm thankful to the Empower T1D community, Empower T1D leads for giving me this space to talk about this very important topic and to express my thoughts. So my perspective about when we talk about language, language has many elements, the spoken word and also the unspoken. And both of them have deep impact. Both of them need to be discussed and both of them need to be thought about. The unspoken word, the manner in which something is spoken, the intent, all of that is felt. So I believe we should have a holistic discussion and understanding of what we mean when we say language.
Thank you, Suman Bhai. Now, let's look at our objectives. Are we here to blame the society? No, we are part of the society. It is us we are talking about. So it's not them and us, it is all of us together. Understand how language influences emotional well-being, understand how diabetes self-management is a responsibility of those living with the condition. So if I make a wrong choice, should I be judged for it? Maybe it's a learning situation. Maybe it's something I have learned a lesson from rather than being blamed for. Words like, why was your blood sugar so high? Has a very different outcome than somebody saying, do you think you could have done something differently? Recognize stigmatizing judgmental phrases commonly used in diabetes care, whether it's at your HCP's office or whether it's in your family atmosphere, or it is among the friends or at work. You know, a donut tray comes in at work and you pick one up. People who know you have diabetes might give you a different look. And like Sumanji said, it is not just the words. It's everything. It's the attitude that comes with it. So be aware and Shweta ji has the solutions. Shweta ji has said that I am working in an organization where I'm trying to recognize the issue, the problems, and find solutions. And we will be hearing from her at quite a length about how she recommends and how we can bring about a change, because a change is needed. I was diagnosed in 1987. It was a very different atmosphere. A lot of diabetes was very private and personal. Today we have CGMs that send out alarms and sounds. So language is not just what we say and hear, it is literally the sounds that can put a judgment. Ah, her blood sugar is going up. Ooh, her alarm says she's low. Oh, she didn't do her job. So definitely, it's a very different environment today. And that private condition is now in the public domain. And sometimes a lot of parents would want to hide it because they don't want judgment. A lot of adults living with diabetes want to conceal it. And we as advocates say, no, we are not to blame. So why are we trying to conceal and hide in order to avoid the negativity? Advocate the respectful language is what Shweta ji is going to teach us about and help guide us. And we have Bhumika as well, who is speaking from an advocacy point of view within the community. Next slide, please. And I am going to invite Bhumika to say how does she feel when she goes into her um, whether it's a social event, whether it's the doctor's office, whether it's at work or with her friends. How does the LANGUAGE, jo hum, we should have pom-poms in our hands, say L for listening actively. So Bhumika, please tell us, how do you help or help people recognize कि आपने शायद ये गलत बोला है. And for me, it would be my own khala and pupi and the relatives who are close to me that I had to re-educate. So
Uh,
Bhumika, inviting you.
right. Thanks, Asra. So as you mentioned, you know, uh, uh, within the family, if you feel uncomfortable with any comment that somebody has, put on you, so maybe it's okay to maybe go back to them and say, okay, this is something that I did not feel right. Maybe instead of speaking to me like that, can you rather use like more encouraging or rather collaborative language. So, from my experience, like working with, small children, it's often, parents often, say this to the children, you are careless. तो ये अपना ध्यान नहीं रखता है, ये अपनी शुगर का कंट्रोल नहीं रखता है. So when this comes from a parent, I think it puts the child in a guilt. It he feels like he's not meeting parents' expectation. He's in a self doubt. Maybe I'm not just good at it. So these are not just comments; they are affecting the altogether the identity of the children. And that is what we have often seen, that children then rather become rebellious. From my own experience as a teenager, I remember like not sharing my sugar readings with my parents, being very rebellious of not talking about diabetes with them, because I felt maybe instead of helping me out, maybe they are going to put a blame on me. So the language that we come across for handling children, handling is very important, so that it doesn't feel judgmental to them.
I think social media as well, Bhumika. It's I might see an advertisement for something that is claiming to give me a cure for type 1 diabetes, or saying that you haven't done enough. Why don't you do this as well? Or whatever is coming in the social media. I heard once an advertisement for a food product that said that eating this could give you diabetes. And what's your take when we see that? What do we do? Do we call it out? What do you suggest we do in day-to-day matters? Sometimes it's within our reach to call out and say, hey, can you not say that?
That's right. I think as advocates, I think it's, and especially like adults living with diabetes, to make it, we are doing all of this to, for the next generation to feel very, to have an environment which we didn't get. So like Asra mentioned, like 1987, that was a completely different era. Even 15 years, 16 years back, I think I remember it used to be a private thing. Now our entire efforts to, talk about diabetes and uh, come out is to help, in these situations where we start calling out, okay, this is wrong, this is affecting our community, this is something that shouldn't be done. uh, so yeah, I think definitely, like, these media is playing a role. It can play like role both positively and negatively. We often see like ads where people are injecting very confidently, so that gives a, encouragement to the child. But on the same side, we often see videos where they are claiming the cure, where they are, so media is doing the harm out there. Maybe, we have often seen in very Indian serials where, as soon as somebody they goes to a doctor room and then they are diagnosed, and the doctor say it on their face, okay, now you have diabetes, and it comes out as a shock, and then they fall, and then, things, the social, or the media has put it all as a drama as well, but then it's affecting the person living with diabetes.
So negative stereotyping, I
Yes.
would definitely, and this is where we want Shweta ji and her solution to come in. Negative stereotyping ko, Shweta ji, how do we take it to a positive picture? Stigmatizing and hurtful, undermining language को कैसे change करें? How do we engage people and blame को हटा के to start talking about it with a little bit more uh, balance? How? So Shweta, could I please encourage you to
Yeah.
talk
First of
about
all,
your work?
hi everyone, and thanks Asra and thanks Riddhi for such a lovely and enthusiastic introductions out there. I believe you are in full energy, Riddhi. So, what I feel, what has come out from what Bhumika and Suman and Asra, what you have mentioned is that what language feels like and what better language looks like, but how we can actually enable this better language, what normally people are calling it person-centered language. How do we enable that in the real world interactions? That is, I believe, uh, is and has been the biggest challenge, because I believe what the language matters movement, which I believe started around 2011, right? It's almost 14, 15 years, and it has spread across to 60 plus countries. And there's a wonderful work which all this community members and everybody is doing, but still that is happening. So when we, during the course of our work, started to figure out or started to analyze what are the patterns, why this is happening, so there were two, three aspects which came out. Now, the first aspect was like um, that the training or the way everybody has been talking from the very beginning. How you can say the medical language evolved, whether it's at the training level at the medical colleges level, if we talk from a clinician standpoint of view, or if we talk from a nursing education point of view, there's a training which is happening. So this language got normalized, and the problem was that there was no feedback, objective feedback, which I'll say. When I say objective feedback, it is like everybody expects you to be empathetic, everybody wants you to like talk nice, but how that empathy and words are actually expressed in by language, that was the missing piece. So the feedback was abstract, that's what I say. So we try to look at that particular piece to bring about that kind of a, you can say, a behavior change, because something which has been built from the very start, it will take effort to change. So that's, I'll say in short, in a way, how we can look at it.
That is absolutely amazing. So, you are suggesting that we become collaborative with the person living with the condition, as well as the people and their family who are trying to help them. Because our HCPs or our boss at work or our friend or that sympathetic older or even your own generation family member are only trying to help you, but
Yeah.
for them to understand the bias that is coming through with the choice of words, that is what we want to maybe just amplify. That negative language will lead to negative results. We have a saying, I work with children with learning disabilities, and that is actually where my post graduation comes from. And we used to always say to the teachers in the classroom and to the parents, if you have negative expectations, your child is going to try so hard to fulfill them. सो सिमिलरली अगर आप बार बार बोलोगे अरे तुम नहीं करते हो, तुम यू डोंट डू इट, तुम यू डोंट लिसन, or you don't understand, then that child or even the adult, because they're so trained to accept, okay, that is what expected of me, I'm actually fulfilling what is asked. Next slide, please. So one of the things you want to remove is the judgment, and as well as the uh, blame for, so the questioning, the way the language is protected would have a very, very big influence. Sumanji, just to get you in, you have a young lady with type 1 diabetes at home. She's a preteen. She's not even quite a teenager yet. How do you modify your language? How do you see that morning or that afternoon or post meal blood sugar? How do you modify and ask your questions? Because CGM तो आजकल सब कोई follow करते हैं. How do you do that?
So the first thing I would say is I'm not perfect. So sometimes even I am guilty of using language that might be hurting her. So I will accept that, and I always try and improve myself. I ask her to actively give me feedback. I take that feedback and try and be very conscious about it. And I be very transparent with her about it. I tell her, you are empowered to tell me whenever you feel hurt. You are empowered to make a choice. For example, at school sometimes suddenly she calls us and says, oh, I'm out of this, or I have a high, or I have a low, what do I do? Or I don't want to eat home lunch today, what do I do? So we started telling her, it's okay, you can make a choice, you are growing up, you can make a choice, just try and make a healthier choice. Even if you want to have something that you like to eat today, that's okay, just a keep a balance in mind, thinking that okay, today I have had something, tomorrow I'll make another choice. Just keep mixing up, because something that is healthy today, like I don't know, in Hindi there might be a saying, in Telugu we have that saying that if we eat too much good, that's also bad. So something that is healthy, if we just eat that, that can also not be so productive. So sometimes we have to treat ourselves, we have to indulge ourselves. So it's okay. And I am learning. I'm learning that, I shouldn't be imposing on the child, but I should be giving her that space and opportunity and that comfort level so that we can do that together.
That's amazing. I mean, that as a parent, you are in the process of giving her the power of choice, that, but also you have given her the power of consequences. So accepting the consequences of whatever she chooses to do. My choice yesterday was to have that pizza. Her choice might be to have 3 donuts with her friends. And the consequences, whatever they are, I would say, are something that's going to be a learning lesson rather than something that describes me. So Shweta ji, अब हम तो बहुत ही, we went to a very private home situation and said, how does one father deal with one child? But you're dealing in corporate India. What is the change and how are you helping using AI to implement these changes? How are you evaluating कि change कहाँ आ रहा है, कैसे आ रहा है?
Okay. So, before I move on to talk about the change with technology or AI, let's go back and, I mean, during our interactions as well as the work which has language matters movement and the studies which have happened with them, and plus the individual research that we were doing, we've interacted with the different stakeholders, right? And one piece which came out was that the intention is right. There is no problem at the intention level. Everybody acknowledges that yes, language is important, whether you go and talk to a parent or an educator or even a clinician. But what happens is when they go back in their high pressure settings, for a clinician, it would be like in the clinic, so many patients out there. For maybe a school teacher, it would be when she is having such a big class with so many students and individual attention might be a challenge. Similarly, for educators or an advocate. So, what happens is when they are operating in this high intensity pressure environments, they tend to fall back on their, you can say, the default language, what they have imbibed and learned all over the years. So, and I'll correlate this with another example. Like we see high motivation speeches we hear out sometimes. We want to be positive, right? And the duration or the impact of that particular speeches stays for the while we are there in the session. After that, we are into that normal thing. So the missing link was that how can we make that consistent, not an episodic kind of a learning, right? And is there something which is available as a support tool to an educator, to a clinician, to a parent at the time when they are doing or conversing with their person with diabetes or person with any other chronic condition? So if they get some support tool which can actually help them to reflect, first is make that particular language visible for that particular scenario. And once they understand that this is the challenge, then only they would be able to learn that what could be a better way or a proper way to further. So we believe even small shifts will be able to make a big change out there.
Next slide, please. And I think the shifts you're talking about are actually right there.
Yeah.
How to phrase.
So, and just to add, Asra, on your second part of the question,
Yes.
what you mentioned was how we can use technology and AI. So, AI and technology, what happens is that it's not that when you talk to somebody, people will say empathy, good conversation, and AI, they don't match. Where is the human element, right? So what we are saying is that we are not replacing the human effort or the human empathy, but we are trying to give a support using AI or technology because the technology is now actually capable of recognizing patterns. When I say patterns, patterns would be the what is the choice of word people are using, whether it's stigmatizing or not. What is their tone, whether it's directive or collaborative. So these are patterns. So if technology is able to support and tell the human that yes, this is something which needs to be corrected, but the correction has to be done by the human only. So that's how
Oh,
technology is playing a role. I hope
Bhumika?
I'm able to
Yes.
explain that change.
Yes, yes, yes. And I
Yeah.
know now I'm going to shift a little bit because technology is available, AI is available for the educated, for those who are using smartphones and whatever laptops and things. Bhumika, you're working at all levels. You're working as a diabetes educator and somebody who's living with diabetes, but you're working with people who will not have access to the chat GPT and the Gemini and the perplexity language. How are you able to, we still want the same change, no matter whether it's in a small town, a village, or the city, or anywhere. How would you recommend and how do you think a study conducted in 2018 in UK suggested that the communication skills, exactly what Shweta was talking about, are ingrained in us? So now how do you take this to that small town, a small house, and a small, maybe the clinician as well? Help us, please.
Right. So, I think from our conversation till now, we understand that we want to shift the language from being judgmental to become collaborative. So now those subtle changes have to come in our language. So how, just taking a few examples, let's say, at home, there's often like food policing. So people say like, mithai mat khao, sugar बढ़ जाएगी. So we can say कि अगर खाना है तो maybe कैसे balance करे, कैसे insulin ले. So the parent, instead of saying it a no, as Suman ji was telling from his experience also, instead of just saying it as no, just say, how can we manage it better? Uh, uh, More examples can be, uh, for example, इसका शुगर हमेशा हाई रहता है. So now we are calling this out very
Yes.
publicly, and this might just affect the child so much. So maybe just speak to them privately, ask them, okay, how are you feeling, how's your sugar level. So uh, it has to start like from the home level for sure. Being very collaborative. Thoda, in India uh, we have so many festivals, like the child has to enjoy those festivals as well. But with diabetes, there's just a little bit more responsibilities, but that doesn't stop him from celebrating these festivals. So the parent has to be a bit more collaborative. Now, the same thing, like in a clinician setting, we often see that there are often very strict guidelines. Okay, like a clinician will just give a. I remember like getting a full diet chart where this says, okay, mango and a cross, and banana and a cross, and then there are a few items where there will be a tick mark. So we have just put all the items in a very yes or no format. Now this is the gap that we are seeing where uh, and and we know that in real life, like we are humans, we have our social life, we are going to have we are not going to have the same routine every day. Like as an adult, I know my work can stretch for long hours. Some days I'm traveling, some days so there has to be some flexibility in the approach of clinicians as well, where they try to be more collaborative. Okay, you have this schedule now, how do we work around this uh, for a child as well? Like if he wants to eat something, like of course you're stressing about eating, but uh, you know it has to be, rather than judgmental, like we have to start being more collaborative.
I love that word, collaborative and supportive, understanding, exploring. These are our respectful words. I'm going to give my last question and then I'm going to invite Riddhi to come in. This is for everyone. In your capacity as a parent, as a corporate change maker, as somebody living and working with children and adults in an educative and clinical atmosphere, Bhumika. So, all of you, Shweta ji, Bhumika, and Suman ji, if there was one thing you would like to see changed today, where would that be?
The change which I believe should come is more in terms of, rather than a directive language, it has to be collaborative, because that will actually involve and engage the person with diabetes more. Because as we all know that diabetes is something which requires, or you can say it's more of the self care. Even more than the treatment itself, self care is more important. So for a condition like that, I believe this collaborative framing, when you are involving the person in managing how they're going to manage themselves, that plays a very important role. Because I believe a person with diabetes is just spending maybe around 60 minutes to 120 minutes in a year with the physician or any educator or a person who is actually taking their condition. But I believe the remaining part, which is around 354,000 minutes, and I believe this research, what Language Matter had done, that was a beautiful outcome, and that what came out from our discussions also, that this is the time the person is actually spending with himself or herself. And but what minutes are spent, the way it is spent has a huge impact. Something. So I believe collaborative framing is something which needs to be done more. That's from my end.
Bhumika, in a clinic, doctors will say, "मेरे को time नहीं है ये सब करने." How do you talk to them about that?
No, definitely. Like we were discussing, and so it shouldn't feel like, you go to a doctor and it's like a report card. Now it's your results day. You stand in front of them and you are scared of what is he going to tell me? Like, is he going to scold me? Uh, and that is how, we are fearing the clinicians. Like they are on our side. They are supportive. We need their guidance. Like even after living with diabetes for so many years, we still need them to, answer our or help us out with our with living with diabetes. So uh, I think yeah, it shouldn't. It has to be such that I am very comfortable telling my doctor that this is something that I am facing, and then in return I get that language where it feels more collaborative, and we get to a solution in a very collaborative manner. So this is something that I'll say the shift that I would like to happen.
So, Sumanji, now what is that one thing as your daughter grows up and you want her to have an adult life? What is the one thing that would matter the most in everyday language? And you have the advantage कि आप एक ऐसे country में हो इस वक्त जहाँ legally she is protected. But day-to-day language, what's the solution? What do you look for?
Oh, that was a very perfect way that you said it. Language doesn't have a legal framework, so it's not protected. Anybody can use any language, and that is acceptable in the legal landscape. Anyway, that's a separate conversation. But what I would like to always stress upon is that empowerment. I think like it does echo what the other members have said very thoughtfully. Don't shut down anyone, whether it is by saying you can't eat this, you can't do this. My daughter has experienced that spectrum. We have experienced, my family has experienced that spectrum. My daughter was told by a peer, "Oh, you cannot dream to be an endocrinologist. You have you are suffering with this. Or I was told by my own family members as well as some physicians, don't think about cure, don't think about something else, just accept. So that, I think, like, not just in the diabetes space, but even in general, we should not shut anyone down. We should not turn off anybody's dreams. Let people fly and magic will happen. And as I say that, I'm reminded that a few years back, I challenged someone that, there was some incident, and I challenged someone that I would give away everything and anything when the type 1 diabetes cure comes. And they were like, this is never going to happen. And today we are in a time when a real cure is happening. There is progress, and we can, I know it takes time. I'm not promising anything, but I know that there is real progress that is happening. So let imagination be free. Let that be a child, let that be an adult. Don't limit anyone. That's my key takeaway.
Lovely. Riddhi, you have built a community that is amazing. It is very wide. For me, I think I would say anything that has come negatively from whichever direction, our diabetes community has helped negate those effects and bring back us back to the balanced side and say, hey, you don't need to listen to that. You are more, way, way more than that. So, Riddhi, please, it's all yours.
Thank you so much, Asra. That was really crisp moderation. And it's a lot of hard work. And I'm so happy that today we're not really doing a purely scientific session, because I think all of you really spoke what is very close and personal to you. And that's what really makes this session very different. As we were discussing about this theme, I remember very well that we all said that, yes, there are challenges. A lot of good work has happened. A lot of good work is, continuing. But we are here to discuss the challenges and also bring the solutions. And that's what really, I think, Shweta beautifully highlighted. And Asra, you put a very positive spin around the whole thing. I'd like to share a few things which really stayed with me. I think to begin with, I think Asra's really amazing statement about power of choices and consequences. I think that's really my biggest takeaway, because the more well informed you are, on a certain day you do choose to have a jalebi, and you know how to manage it, right? So with the right education, you manage it. And I think a lot of conversation did veer around food, as Bhumika also shared some experiences about the yes, no, the food bracket. I totally relate to that when I got diagnosed. And even Sumanji said that, how he, empowers his daughter to make the right choices. And India being such, we love with food, right? So these conversations are very important. And many a times I have realized it may not be important to me, but when I meet more people in the community, their state of happiness on a certain day depends on what they were allowed to eat and what they were forbidden to eat. So I think that whole thing about not being directive is such an important thing. And one more thing which I really wanted to point out, which Shweta ji really, shared very beautifully, is that how empathy and words can be expressed by language, and how can we take this from sessions into real world. I think that was very important, because most people who are working in the space are always in high pressure environment. And I think this one just happened to me 2 days back, when a type 1 was reaching out to me for some support, because they were battling high blood sugars. And the earnestness with which we want to help, हमें हमेशा होता है कि हम जल्दी हेल्प करें, but instead of being hurried and rushed in our solution, it's important for us to pause. So for me, what is my learning as a diabetes educator can I take a moment to reflect, to pause, and then give her a collaborative answer? Don't worry, it's high right now, but we'll do this together. And instead of asking, what is your number? How are you today? Leave aside the number. So that comes to us only when we are not in high pressure, or rather in maybe it could be intense, medium pressure, but the quality to time and again pause and reflect, I think that's very important. So instead of addressing 10 issues, address 3, do it beautifully, do it mindfully. I think that was one amazing takeaway. And I think this movement has been, around for a while. And I remember when I got into advocacy, I always used to watch Jazz say that you do you. So I think to say what, to add to what Sumanji said, that there is no right solution. You do what works for you. Let people live and fulfill their dreams beautifully well. Type 1 should not stop them. No chronic condition should stop anyone. Our role in the system, as Shweta working towards solutions with tech and AI, as Bhumika doing her advocacy, and as Sumanji setting an example for caregivers and healthcare professionals and educators, our role should only be to bridge the gap. And once in a while, pause, reflect to say, how can we work together? How can we do better?
Sometimes I think we need accommodations in order to do our work correctly, in order to be the empowered and the collaborative. वो सब बातें बोलने अच्छी लगती हैं, but we need tools and we need accommodations. Children at my school, when they had exams, I needed to make sure accommodations were made for them so that they could be at the equity of somebody without a chronic condition. जो डिसएडवांटेज हो गया है उसका तो थोड़ा सा बूस्ट चाहिए to become at the same level as the next person. And a lot of people don't realize that our hidden disabilities, and I don't like to use the word disability, but in a lot of countries, diabetes is recognized as a hidden disability. It is definitely a non-communicatable hidden condition जो शक्ल से हम में से कोई नजर नहीं आता है कि आप डायबिटीज के साथ जीते हो. And we make it look easy, but looks can deceive. So that is where I'd like to end. Ask me how I am rather than seedha numbers dekhne doctors and mothers and fathers and the time I might need to take a little minute to go check my blood sugar and have a hypo snack, or I might just need to take a breather and deal with the day. I might come to work half an hour late because this morning, for whatever happened in the last 5 to 6 hours, I might need that. So, work accommodations are not something that we are asking extra. And that's a very hard pill to swallow sometimes. Oh, I need to let her off because she's having a low, or she just needs a time to breathe.
Yeah.
So that's where I'd like to end, please.
Yeah.
I see Dr. Manisha is here. I think she would like to say something.
I'm so mesmerized to listen the entire conversation. I was a very dormant kind of today because yes, we deal with a lot of T2Ds, but this language certainly matters. At times they feel offended, like doctors directly asking कि मुझसे तो पूछा भी नहीं मैं कैसी हूँ. So that's what matters. I loved your moderation. You were amazing. And thank you, Riddhi, for bringing everybody together from different time zones. It was really difficult. And Suman is might be night for Suman, right? Or Suman early morning, a very early morning probably. No?
Yeah,
What
it's
time
early morning.
It's early
It's
morning?
8:30, but yeah, I had a long work night as well. But yeah,
Yeah. So
this
thank
is
you
something
guys.
very important. Yeah.
Thank you so much for putting everything so beautifully accumulative, how we should be and how the conversation should be. And Shweta, for this conversation AI, we really must come up with certain algorithm just to put this in our for the physicians especially need to learn a lot in this regards. And Bhumika, thanks for like you're sharing your lived experience, how कि जलेबी कैसे खानी है और ये कैसे करना है. That's really matters. Thank you guys. You guys were like beautifully explained everything. How does the language makes a difference in mental health and a quality of life of a well-being. Thank you so much, and thank you Riddhi for putting everything together. Thank you so much. You are like backbone of Empower for all the activities. Thank you.
And I would like to thank everyone. In fact, everybody has been talking about that we are building solution, but I would like to add one point over here, that whenever we are having all these interactions with real people, it's a different learning, and it helps us actually to build all these reflections into the system what we are building, to make that more powerful and useful for all of us. So I believe these interactions are very helpful, and thanks for inviting for me for this such a wonderful discussion out together. To all of you, I mean the fellow members who have been there, who have been contributing, and thanks Suman, thanks Bhumika for all the lovely insights you have brought in, and Asra, the way you have been questioning us on the different aspects.
That requires a skill so much.
Yeah, and Riddhi has been able to do it very nicely, and she was actually picking up one or two beautiful pieces of each one of us. Riddhi, a nice capture at the end. I believe that it's a ready reckoner for all of us as a takeaway.
Perfect, perfect.
Yeah. So
Great conversation. I think thanks Empower for having this platform where we are discussing every month. So this is very important. But love the discussion.
Yeah. Thank you.
Thank
Thank you
you
so
so
much.
much, Riddhi. You
I
and
would
Empower T1D, and thoroughly enjoyed it. Thoroughly enjoyed it. Thank you so much.
Thanks a lot for this wonderful session. I think Sumanji wanted to say a couple of
Yeah.
things. Yes, go ahead.
I wanted to add my closing thought as well. So, a lot of conversations seem like they are personally directed or directed to a certain subset of the community, like parent community is on the receiving side sometimes. The person living with type 1 diabetes, he or she is on the receiving side some of the times. But it's also hard. What I want to call out is the physician community is on the receiving side a lot of times. The endocrinologists, they put in a lot of hard work. They are in tremendous pressure. I want to acknowledge that most endocrinologists, I do have a couple of negative experiences, but those aside, I have like very, very good experience with very, I would say like uh, at least 10 plus endocrinologists.
Great.
A couple of them actually came to me asking, like, we are not familiar with each other, but they come to me asking, oh, you are a caregiver of person with T1D. How would you like an endocrinologist to approach you? What are the challenges that you face? Like, those are beautiful. Like, we are seeing that shift that people are trying to learn. As I said, even as a parent, I am not perfect. I want to learn. So having that kind of a growth mindset is very important. And I think, like, yeah, I would like to thank the endocrinologist community as well.
Thank you. Thank you.
Take a bow.
Yes, absolutely. Because at Empower, we are really nothing without
Yes.
supporting clinicians. And right from day one, they have been, putting in so much faith into us, recognizing that we are at the core of, everything we do. So very rightly shared. And I'm always very grateful because they let us lead, they let us choose. And, that's why we all are. And some of us have been really lucky with even our diagnosis and consultations with amazing endocrinologists around us.
Thank you. Thank you so much.
Yeah,
Thank
thank you
you,
all
everyone.
the speakers, and thank you very much, Asra. And hope we continue to take this conversation ahead, and maybe once in a while check in and review again. And I really appreciate everyone joining from different time zones. We look forward to have you again. And with that, wishing you all a very good day and a very good night. Thanks a lot.